Well, should we start or should we hang on here? Cheryl or Erica?
Yeah, I'm here. Turn my camera on. We can get started. Andy is co-host. Let me just stop sharing my screen. You're welcome to share whenever.
Oh, I don't need to share anything. Andy. I'll just say a few things to begin with. First of all, welcome to February. It's Groundhog Day today. We're going to find out how long till spring comes or whatever. Which means it's my son Ben's birthday, and it's his 30th birthday. Just to say, and the FES Center proposal is getting very close. We have to do some assembling. I told a couple people that were on earlier that I read through the whole thing today, made a few more edits and smoothing, but I think that's it. We got some appendices and things to fix up, but we also have the rest of the week basically. So we can upload it in pieces, and it's going in pieces. So this might be, knock on wood, one of the more relaxed submissions of this monster in my memory.
I can't believe you said that out loud, Bob.
Well, you know what? I'm not a superstitious person, so and I have to say, it's incredible what all of you guys do. I've said this before. This is really a great proposal. I mean, and it was written by a bunch of people, and we have a really great thing going here. So thank you for all your efforts. I'm really I don't have any concerns about submitting this proposal. Let's just put it that way. It's really great. Okay, so we have some upcoming events, and I don't see them anymore. I don't have them written down, so there they are. We have a neuroprosthesis seminar on the 11th of February. Another one from Germany. I've announced that before. There's another one at Bay. We'll probably fill in some in the middle there. Been distracted with this proposal, but we have some people that we're going to invite. Today, Andy's going to talk about a brand new center that he's in charge of that was just awarded. So I think I will just stop at that and give it to you, Andy. Take it away.
Thanks. Let me put it here. Did I share the right screen? Do you see the presenter view or the
actual slideshow? That's correct.
All right, great. So thanks everybody for joining. I am Andy Cornwell. I'm the Director for Industrial and Strategic Collaborations for the FES Center. And like Bob said, we were recently awarded a center to do exactly what it says on the tin. It's called the VA Translational Education and Mentoring Center. And we will be mentoring teams of VA investigators to help them with translation and commercialization of VA technology. So I don't know what Erica's rules are for the seminar, but as far as I'm concerned, if you have a question, just jump in and interrupt. I'd rather have it be more of a discussion than a lecture. So, I only have maybe 15 or 20 minutes worth of slides. So just jump in anytime and just have a conversation. That's probably better. Let's see. So what is the VA Team Center? It's a center funded by BLR&D, which is one of the research services in ORD at the VA. And the goal is to change the translational research culture within the VA as much as anything else. So they definitely want to take individual projects and help them move toward a license, but they also want VA investigators across the country to be a little more versant in translational research and what it takes to get things out of the VA. The program is based on a program called C3I, which was started as part of the Coulter Translational Research Partnerships when those were originally endowed, whenever that was, 15 years ago now, right? And then the didactic portion and the programmatic portion was adopted by NIH. So certain kinds of awards are eligible for supplemental funding to go through the C3I program at NIH. So certain SBIRs and RO1s. And we are using that program, which has proven to be pretty effective at changing culture and moving teams toward translation within the VA. So there are two parts. There's really three parts. I'll talk about this, but the two parts that I'm going to talk about today are this phase one, which is a pretty light touch, general background part of the C3I curriculum. That will involve, each team is assigned a program manager and a business advisor. So you get some mentoring and advice from experienced people. And then at the end of that, you pitch to a selection committee to be selected for phase two. And phase two is much more intensive, much more hands-on with the mentoring, and much more involved at applying the concepts in the didactic curriculum to the specifics of an individual investigator's work. I'm kind of going to skip this. I'm just going to point out that the three PIs are myself, Bob Kirsch, and Robert Bonomo, who is a drug development expert at the local VA. So it's housed here at our local VA, but it's a national program. We have a selection committee, which is people sort of outside who are looking at these things to choose which ones have the best chance of commercialization, basically, and then supported by a team of project managers and business advisors. And what we're trying to do is help investigators figure out, what's next with their research, right? So I wrote to validate the basis and the direction for further investment of time, energy, and money by the project team and by future investors. So what is the next round of investment? Is that another research grant? Is it an SBIR? Is it a venture funding? Or is it maybe a sponsored project from a strategic, or a license directly to a strategic? What do those people need to see in order to be convinced that you're making progress in buying down the risks that are outstanding in those projects?
Andy, you just might say what a strategic is. Not everybody's going to know that, I think.
So yeah, strategic companies in this context are in the device context, especially in neurotechnology. There are three ish strategic companies, and those are big companies that are typically responsible for they own most of the market share in these different things, and will buy technologies out of universities and buy small companies to advance their portfolio. So in our case, in neurotechnology, you might recognize Medtronic and Boston Scientific and Abbott. But if you're in the drug development space, strategic companies are like Pfizer or Merck. Companies like that. That's one of the things you might learn if you participate in the VA Team Center program. This is fun. Okay, so this is what I was talking about. There are kind of two parts to this program. The part on the left is what I'm talking about today. I kind of already went through it. The Translational Education Core is another piece. It's not connected to the mentored program, and that translational core will be a set of didactic stuff that people can just jump onto at any time. They can step through a program like a curriculum on their own, or they can just dive into individual things they kind of want to know more about. We're also going to run a series of like lunch and learns with people from industry or from the translational process in some way who have something interesting to add to the conversation, and hopefully those will be interesting and fun to attend. I will say about the mentored program, where the application phase is open right now. It's open to VA investigators. So if you have VA intellectual property, or VA has some ownership interest in some of your intellectual property, you're eligible to apply. The application's open right now. There's an RFA that's been released. If you haven't seen it, you can go to our website, va-team.org, and check that out. And the application's due next 2 weeks from today, but it's very straightforward. It's a very small application that just describes the technology and your understanding of kind of the clinical need.
Andy, did you say that you have to have the VA has to have a piece of IP?
A piece of IP, yeah. So they have to have some ownership interest. If they haven't made that determination yet, they're willing to let things go forward if they think that there might be some ownership interest in the future. So
this is a good thing for the investigators that in the last couple of years, the VA has just grabbed a bunch of stuff.
I think so. Yeah. So the timeline, maybe I'll just mention something about that real quick. So almost everybody has a joint appointment at an academic institution and at the VA, and that's true here, but also at other VAs across the country. They all have academic affiliates. And when you invent something and file an invention disclosure with either the VA or the academic affiliate, case in our case, so if you file an invention disclosure with one of those organizations, they share it with the other one, and then they make a determination that the invention was done either completely at case with non-VA funding and non-VA resources, or it had some VA in some case, or it was done all at the VA. And so, yeah, the VA has to make some determination that some part of that work was VA involved. So that's how you would be eligible. So the
that's
timeline
not usually going to be a problem if you're a VA employee.
It's not at all, right? All of your IP is VA IP if you're a VA employee.
If you're a VA, if you have an appointment, they're going to claim something. So I'm just interjecting.
Yeah. Okay, so the timeline looks like this. The proposals are due in a couple of weeks. Right away, we're going to select the projects, and then the phase 1 programming begins in March 15th. Then I'll just talk about the phase 1 programming is a chance for investigators to kind of raise their gaze a little bit and talk to stakeholders, identify stakeholders, talk to stakeholders in their field and identify, kind of validate what they think the need for their product is and what the value proposition of their solution is. And so learn how to conduct those interviews, learn how to understand clinical need, and then learn how to write a value proposition. And at the end of phase 1, the 16 teams that are selected for phase 1 will pitch that information to the selection committee again. And then the selection committee will down select from that 16 to 8 teams to go forward in phase 2. Phase 2 starts in June and goes through the end of January of next year. In the beginning of August, I think it's the first week of August, the second week maybe, there's a 2-day boot camp, which will be done in person, but not this year. And that is a great chance. You present to the business advisors and to the other teams. The business advisors will present lectures on specific topics, and the teams sort of work through homeworks and develop, kind of responses to those, and then present them to the whole group for feedback. And it's a really cool opportunity to get to know the advisors, the business advisors and the project managers and the cohort of other VA teams that are going through this. And, those people end up being a great resource as you go forward, to help along the translational pathway. They're dealing with the same sorts of problems that you are, and are often a useful resource. So I think that's a great thing. I'm sorry we can't do it in person this year, but I'm quite hopeful that we'll do it in the future in person. At the end, we have a finale event, which we are planning to do in person in Washington. So at that point, you present to VA leadership and the tech transfer program. We're going to get some of those strategic companies and venture capitalists to come and watch these presentations and see what VA research has to offer. It's a great chance to cap off the experience of what you've done, learn how to prepare and present a pitch to people who are not experts in your field, which is arguably the most critical piece of translational research. And so that finale event will be kind of middle of January of next year, and then we'll start another cycle. So we have 5 years for this, and we'll see what happens after that. Yeah, just briefly, if you saw some other material that said phase 1 starts March 1st, it doesn't, it's starting March 15th. So requirements, teams have to be passionate about translation. This is extra, really. It's hard work. It's a new set of experiences and a new set of understanding. And, you know, teams just have to be willing to take that on and be willing to do that work to help their research end up in the hands of clinicians for veterans. And that's the most important thing. Projects should be represented by VA teams, by, you know, an engineer and a clinician working together, or a scientist and a clinician working together. Teams must be able to devote some time to this work. So across all the people working on it, it's not just the PIs. If you have, you know, postdocs or graduate students in your lab, they can chip into this. But it should be about 5 hours a week, I think. Hopefully not too much more than that regularly, but it could be at certain times, especially when you're doing a lot of customer interviewing. I think it could be as much as 10 hours. So, you know, teams need to have that time available across the team to put toward this. Like I said before, VA has to have some ownership interest in the intellectual property. And then, you know, this program does not have project funding attached to this in any way. So if you go through this program and you identify a series of milestones that you need to accomplish in order to commercialize your, you know, your work, it doesn't do you a whole lot of good unless you have some funding to execute on those milestones. So it's not that you couldn't learn this stuff without the funding, but I think that teams with funding to execute on those milestones will score higher in the selection process than teams that don't. Successful applicants will have a strong multidisciplinary team who are willing to do the work. And really, I think the most critical thing is that you have identified a strong clinical need. And then ultimately, you know, we'll help you figure out how your technology brings value to that. A VA-owned IP that's close to a license. I put 5 years here. I think things that are closer to license will be given priority over things that are further away. But you know, I would encourage you to apply to this if you don't know where you are on that time frame. And then your project has to have relevance to veteran healthcare. So to apply, you go to our website, va-team.org, and you read the RFA carefully and thoroughly, and then you download the application, you fill it out, and you email it to this email address, apply@va-team.org. And that's it. It's very straightforward. The application is like a page and a half. There's a very small section describing your technology, and then 2 sort of, you know, half-page bits about the clinical need and the value that you think you have right now. There's a spot to upload a picture, and that's pretty straightforward. The application is designed to be pretty painless. So if you're considering applying, you can talk to me about it, of course, anytime, but I'd encourage you to just put one in. So I just have a couple more slides here. I just kind of want to build a fence around what this is and isn't. The most common question is, there money attached to it? And no, there's not. We're working on ways to you know, bring some financial incentives to that through different kinds of VA funding. But at the moment, we don't have that. So what it is a translational education program that walks people through this guided process. It really is the gold standard in translational education for academics, and it works. It's a time commitment of 5, I wrote 15, maybe 10, hopefully never 15 hours a week. It's a great way to build a network, which is part of one of the really critical steps to do this. You know, no individual has the resources at hand to get all the steps done to translate research into the clinic, and the network is the way to find out what you're missing. It's a way to validate the need for your technology, which is the one really critical step. It is a way to learn more about academic commercialization in general and the process of licensing and what's involved with that. It's a way to learn how to. It's a way to learn how to advance specific projects. It's a way of thinking about your research that will enable you to advance your work more efficiently toward a license and ultimately toward a clinical application. So I put this back up here. The program is dedicated to validating the basis and the direction for further investment of time and energy and money by the project team. So, a successful outcome of this could be that, what you think has value and is an important piece of the clinical puzzle turns out, the obstacles to commercializing it are higher than the benefit. And that's a positive outcome to enable you to rethink how to approach research and how to address clinical needs that you still have the capability to do through other means. So that's kind of what the project is. I think, nope, that's it. I gave this as a webinar yesterday and I had a poll, but we don't have a poll here. So that's really it. It's just, I just wanted to give an overview of where we are. I encourage you to apply. And if you're not sure, if your project kind of fits the bounds of the application, then just give me a call and we can talk about it. The other thing I'd encourage you to do before applying is just to reach out to our technology transfer specialist in Cleveland. His name is Ryan Davis. You can find his name at VA Tech Transfer Programs website, or I can put you in touch with him. And just let him know that you're putting in for this, and make sure you guys are both on the same page about the status of your intellectual property and where it is and where it's going. And if there's some sort of catch-up work that needs to be done either by VA or by case to synchronize all of that activity, we can get that underway before you apply. So that's all I had. So I'm happy to take some questions, and we're really excited about this, by the way. I have to say, we found out about this award in August and we put in the application. And they kind of halfway told us in December that we were going to get the award. And because of the other kinds of C3I programs that are going on, that we had to start in March. And so we started doing the work to execute on this, and we actually still haven't gotten the notice of award. So hopefully this all comes through in the end, because we're doing a lot of effort. Cheryl and Erica have been working 80 hours a week, I think, getting this stuff together and getting the FES Center application in. So just want to recognize all that effort and say thanks.
Andy, I have a question. You spoke about a gold standard educational program.
Yeah.
I'm curious what exactly you meant by a gold standard educational program.
Well, there's been a lot of efforts to do this, to teach academic investigators how to do commercialization. And this process has been refined over about 20 years. People who have gone through this program routinely have much higher success rates at developing licensable technology, at developing startups, and at getting follow-on funding from venture capital and other sort of at-risk sources. That's what I meant.
I'll just add.
Does it have a name?
Yeah, well, I'll just add, so the Coulter programs have developed a C3I educational program over the years, and it's now been adopted by a lot of programs, including NIH and states and a number of other entities that do translational research. So it's sort of evolved with lots of different kind of input, and it really is kind of the standard for sort of giving investigators that are more scientific perhaps and not really business oriented you know, you don't leave it with an MBA or anything like that, but you leave it with some understanding of how you need to maybe form your research and what the next steps are when you're ready to try to commercialize something. So that's what the gold standard is, because it really has become kind of a standard that a lot of places have adopted.
Have a name?
Yeah, I mean, it's been known by different names. It was started as Coulter College at one point, and then the curriculum itself was sort of pulled out of that and applied to different things as C3I. And I think that's fundamentally what it's called now. Does that make sense?
So the VA, through this program, the VA is adopting it too. And, you know, I will say, Andy didn't really mention this, but this program's open to anybody in the VA that's interested in doing translation. I mean, anybody. So this isn't just Cleveland. This isn't just rehabilitation, research and development. In fact, it's supported by basic laboratory research and development service, but it's for all investigators. And, you know, there'll be a series at some point of lectures online that anybody can do. But what Andy talked about today is more about, you know, people apply and ones that are in a position to benefit from further, you know, the later stages can then participate.
Is this program something that could be part of or is already a part of our undergraduate curriculum? Because there are certainly a lot of students interested in translational. I've heard them speak about in EBME 327, which started yesterday, speaking about what they were interested in.
Yeah, pieces of it are implemented. So Colin Drummond was trained in this mechanism and also teaches the biodesign curricula, all of it in different forms. Steve Fenning teaches part of this in his classes. So I don't know that it's formally implemented in the way that we're doing it. I don't know that it's formally implemented in that way as part of the undergraduate curriculum, but it is part of the design curriculum for the undergrads, I know.
Yeah, it's more part of the design curriculum, Tom. And there are some classes that you can take subsequent to that or in addition to that if you want. Colin teaches, like you said, a biodesign class. There are, yeah, it's not explicit. You know, this is not like a semester long class in duration. I mean, it lasts that long. It lasts a year, but it's a little bit different. You know, there's some didactic lectures, but there's also a lot of sort of meetings and mentoring. And, you know, Andy has gotten together groups of program, you know, people that are out in industry and entrepreneurs who are interested in volunteering their time. Well, maybe not volunteering their time. I can't remember.
Okay.
Okay, no. Well, they're getting paid a fraction probably of what they're worth to do this. And just to sit and help people understand what the issues are with their project. So it's a little more directed, I would say, than a typical class.
Anyone else?
Congratulations, Andy. This is a really big deal for CASE.
Thanks, Steve. I appreciate it. It's a, you know, it's a national program, and so I don't know that, like, I'm not choosing the projects myself. You know, we have this external selection committee, so I don't know that being part of the FES Center or the APT Center gives you a leg up in the process, but I think it's a feather in our cap.
Yeah, absolutely. It's a feather in your cap too. Fred
says, will the lunch and learns be open? Yeah, I want to make I don't know that the higher ups at BLR&D are behind this, but I want to make all of this content available, you know, publicly. think, having the stuff available shows the VA is interested in doing this and sort of taking a leadership position and getting this stuff done. So does this complement or compete with the Coulter program? It's a complement for sure to the Coulter program. I mean, having gone through this process, a team will be in much better state to apply for Coulter funding, if that's the next step. I mean, the whole point is to get ready for whatever your next round of funding is. So if you're going to leave the university and apply for seed funding, or compete for seed funding or a Series A, then that's what the program is designed for. If your next stage is some sort of program like Coulter, then that's what the program is for. So it helps you get ready for that, identify what the risks are, and what you currently have and what you need to, where the risks need to be for that next level, and then you can buy those risks down with whatever source of money you have next. Does that make sense?
Yeah, I would say in many respects it is the Coulter program in VA clothing in a way. It's going to have specialized content, and the VA asked us to do some things that we wouldn't normally do in a Coulter program, but it's very complimentary. I'll just leave it at that.
So Andy, we're talking with the CEO of Johnson & Johnson next week. So I'll try and, of course, I've got all the power in the world. I'm going to muscle him into talking in your course if you like. He'd be an interesting
tell him I said hi, Steve. Just tell him I said hi.
Yeah, I will. Yeah. I can only imagine, right? Yeah.
Any other comments? Thanks, Fred.
And I'm going to ask you something that's unfair. Is there any way of trying to bring people who don't look like you and me into the program, if you know what I'm saying?
I do know what you're saying, and it's a high priority for us. The program is a national program. It's designed to address clinical needs that span, a wide variety of things, from medical devices to health IT to pharmaceuticals to diagnostics. There's public health issues in there that involve addressing ethnic and socioeconomic health disparities. And the team administering the program needs to match the diversity of the problems we're trying to solve. So we are actively searching for a selection committee and an executive committee that is as diverse as we can find it.
Right. So we've been talking with Dr. Charles Essien, who's an African-American doctor, really well respected throughout the world. He wrote an article basically saying that pulse oximetry is racist because, the pulse ox doesn't take into account the different pigmentation in people's skin.
Well, Steve, you've identified a clinical need.
Well,
you're on your way. You could go design a solution to this.
So we've reached out to the guy who actually did the original, Mike Bow, who did the original electronics for it all, and he's come up with a fix for it. So is that something?
See, Steve, you've already gone through the C3I process. You're in a good shape.
But it's pretty cool, right?
It is.
Yeah,
it is, and that stuff is going to be increasingly important for us as in our healthcare economy, I think.
So, is that something that we could sort of talk to you about?
Sure.
I'll just fiddle in the details, in another time. But
yeah, no problem. Trying to look through the list of attendees here and see if I can. Oh, Chuck Montague's on. Chuck Montague is going to be one of our project managers. Hi, Chuck.
Hi.
I was trying to figure out who you were.
It looks
so now I know.
Old where he is.
Hi, Chuck.
And you might think, no, I'm not related to him, I know. Just a coincidence that we look exactly the same almost.
I look better.
That's only because you're younger.
Fred wouldn't unmute to ask me a question, but he'll unmute to rib his brother. I like that.
Okay,
All right.
I have 3 sons. I'm gonna have to say, okay, boys, knock it off.
Yeah. Well, any other questions or comments? There is a link on that website, va-team.org. You can schedule a meeting with me there. And of course, I mean, you guys all know my email address, so just send me an email and find a time if you have questions. And of course, you know, even if you are not eligible or you don't think you're eligible for applying for VA team, you know, for the VA team program, if you have questions about translational research or your research as it relates to, you know, the intellectual property, if you have questions about how it relates to the VA Tech Transfer Program, the relationship between that VA Tech Transfer Program and CASE's Tech Transfer Office, any of the translational funding mechanisms, CASE, of which there are a dizzying array of acronyms, please get in touch. I can help you walk through some of those things. I can put you in touch with the right people. There are some great programs at CASE now. There's a Translational Fellows program, which is buying time from graduate students and postdocs to pursue translational activities. There are entrepreneurs and residents at CASE now who are helping people form companies and identify executive teams to take things out of the university. We have the Coulter program for funding. We have the CTP program for funding. We have our own I-Corps program now at CASE that will feed you directly into the I-Corps program at Ohio. We have CTSA funding. So there is a wide variety of opportunities for people who are looking to move their research out of the lab and into you know, into a clinician's hand somehow. So if you are on that pathway somehow and you're confused about your next steps or you just want to chat about it, please let me know. That's what I'm here for.
So the FES Center in our renewal, it's now we have a new thrust that's called Translation and Clinical Dissemination, and it's been elevated to you know, at the same level as movement restoration and pain and brain health and autonomic restoration. You know, it requires a different set of skills and a different sort of culture, and you know, we're really elevated that starting right now. So, you know, Andy and others can, if you have questions in general about, you know, FES Center activities in this area, just let us know. Maybe not today or tomorrow. I got to get this proposal in, but maybe starting next week. Okay, but you know, we really are going to provide a lot of services and guide people to the right resources that they need. Okay.
Anything else, Cheryl or Erica?
Yeah, I do have one announcement. On the 16th of this month, we're going to have our project concept reviews. So I'm going to send a note out to the center, but if you do have ideas that you want to kind of throw up on the wall and talk to people about and get feedback on, it's the perfect opportunity. So I'll send a note out probably this coming week.
Okay.
Can I just chime in on that? I think the project concept reviews were a thing that Pat Crago came up with years ago, and I think are one of the most useful activities that the FES Center does for investigators. So I really encourage people to participate in those.
Yeah, you know, people feel like they're sticking their neck out a little bit, and that's exactly the idea. You know, if you talk about, we were talking about, you know, what's the clinical need? I mean, this is kind of the counterpart. This is like, what's the scientific need? Why do you need to do this? You know, is it going to be accepted? And people can give you great advice. You can find collaborators. If you're missing a piece of your team, it's a sort of a scientifically stellar group, but is also supportive and helpful. They're not just ripping at your proposal like anonymous reviewers can do at times. So I strongly urge people to participate in this. Do I sound like I'm reading from a proposal? I just finished. It's all right there, at least for today. Yep.
Great.
Okay, everyone. The sun's out. What does that mean for spring on Groundhog's Day? 6 more weeks of winter? I don't remember. I can never remember this.
Early spring, they said. Early spring.
Yeah, okay.
Hey.
Well, whatever. It's going to happen. So thanks, Andy.
Thanks, everybody. Bye-bye.
Yep, see ya.
Bye.